Noong una pa lang kitang nakita, alam kong ikaw na talaga ang the one. Konting ngiti mo lang ay napupuno na ng buhay ang aking mundo. Isang tingin mo lang at parang aatakihin na ako sa puso. Hangang-hanga talaga ako sa kasipagan mo. Kahit puyat ka na, pumapasok ka pa rin sa klase. Ayan, nakangiti ka na. Ang cute! Minsan nga, nagugulat na lang ako sa mga pagkikita natin. Parang isang biyaya na kasi na makita kita. Kahit ilang beses na kitang nakikita, ay nahihiya pa rin ako. But now, I'll take this chance.
One piece chicken joy, Thai part please.
Sartorius is the longest muscle in the body. It originates from the anterior superior iliac spine of the pelvic bone and inserts into the medial surface of the proximal tibia. It is innervated by the femoral nerve. The blood is supplied by the femoral artery. It flexes, abducts, and laterally rotates the thigh at hip joint, which is the reason why it is called the honeymoon or bad girl muscle. Other functions would be flexion and laterally rotation of the leg at the knee joint. Iliacus is flat, triangular muscle originating from the iliac fossa of the hip bone. It forms the lateral portion of the iliopsoas muscle. Together with the psoas muscle, it inserts into the lesser trochanter of the femur. It is innervated by the femoral nerve, and it gets its blood supply from the medial femoral circumflex artery and iliac branch of iliolumbar artery. Together with the psoas muscle, it is the main flexor of the hip joint. However, when the thigh is fixed, just like its sit-ups, it can also flex the trunk. Psoas originates from the transverse process, bodies, and intervertebral disc of the 12 thoracic and 5 lumbar vertebrae. Together with the iliacus, it inserts into the lesser trochanter of the femur. It is innervated by the lumbar plexus L1, L2, and L3. Its blood supply is the femoral artery. It is a powerful flexor of the thigh. If thigh is fixed, it flexes the trunk on the thigh as in sitting up from lying down. The pectineus is a flat, quadrangular muscle originating from the superior ramus of pubis and inserts on the oblique line extending from the base of lesser trochanter of linea aspera on the posterior surface of proximal femur. It is innervated by the femoral nerve, and blood is supplied by the femoral artery. It flexes and adducts the thigh at the hip bone. Rectus femoris is the only muscle in the quadriceps femoris group that crosses both the hip and knee joints. It is a fusiform muscle, meaning the belly of muscle tapers into the narrow tendon on both ends. Rectus femoris has two heads. The straight head, which originates from the antero-inferior iliac spine, and the reflected head, which originates from the ilium above the acetabulum. Its insertion is the quadriceps tendon into patella, then via ligamentum patellae into tubercle of tibia. It is innervated by the femoral nerve. Its blood supply comes from the descending branch of lateral femoral circumflex artery. It extends the leg at knee joint and flexes the thigh at hip joint. Vastus lateralis is the largest and most powerful part of the quadriceps femoris group. It originates from the upper end and shaft of femur and inserts into the quadriceps tendon into the patella and via ligamentum patellae into tubercle of tibia. It is innervated by the muscular branches of femoral nerve L1, L3, and L4. And it gets its blood supply from the lateral circumflex femoral artery. Its function included extension of leg at knee joint. Vastus medialis is one of the four muscles that make up the quadriceps muscle and considered to be the most medial of the vastus group of muscle. It originates from the upper end and shaft of femur and inserts into the quadriceps tendon into patella and via ligamentum patellae into tubercle of tibia. It is innervated by the femoral nerve, and it gets its blood supply from the femoral artery, profunda femoris artery, and superior medial genicular branch of popliteal artery. Its functions included extension of leg at knee joint and stabilization of the patella. Vastus intermedius is one muscle of the quadriceps femoris. It originates from the anterior and lateral surface of shaft of femur, merges into the deep aspect of the quadriceps femoris tendon, and inserts into the patella, which is connected to the tubercle of tibia via ligamentum patellae. Its nerve supply is the femoral nerve, while the blood supply are the lateral circumflex femoral and profunda femoris arteries. It acts with the rest of the quadriceps femoris muscle in extending the knee.
The gracilis muscle is the most superficial muscle in the medial compartment of the thigh and descends almost vertically down the medial side of the thigh. It originates from the ischipubic ramus and inserts into the upper part of shaft of tibia on medial surface, along with the other pes anserian muscles, sartorius and semitendinosus. Its nerve supply is the obturator nerve, while the blood supply are the profunda femoris and medial circumflex femoral arteries. It adducts the hip and flexes the knee. The adductor longus muscle. Its origin is in the body of pubis inferior and medial to pubic tubercle, and its insertion is in the linea aspera. Its innervation is mainly supplied by the obturator nerve, which arises from the lumbar plexus and reaches the adductors through the obturator canal. Its blood supply is supplied by the obturator artery and femoral artery. It adducts the hip joint and flexes the hip. The adductor brevis muscle. It originates in the inferior pubic ramus and inserts into the linea aspera. Its innervation is mainly supplied by the obturator nerve, and blood is supplied by the femoral artery. Its function is to adduct the hip joint and flex the hip joint. The adductor magnus muscle is one of the biggest muscles of the human body and consists of two parts, the adductor and ischiocondylar or hamstring parts. The adductor part originates from the inferior pubic ramus and the ischial ramus, and inserts at the gluteal tuberosity, the medial lip of the linea aspera, and the medial supracondylar line of the femur. The ischiocondylar part originates from the ischial tuberosity and inserts into the adductor tubercle on the medial epicondyle. In terms of innervation, the adductor part is supplied by the obturator nerve, while the hamstring part is supplied by the tibial division of the sciatic nerve. The blood supply comes from the obturator artery, the deep femoral artery, and the femoral artery. The adductor magnus is a powerful adductor of the thigh, made especially active when the legs are moved from a widespread position to one in which the legs are parallel with each other. The part attached to the linea aspera acts as a lateral rotator. The part which reaches the medial epicondyle acts as a medial rotator when the leg is rotated outwards and flexed, and also acts to extend the hip joint. The obturator externus muscle. It originates from the ischiopubic ramus and posterior surface of the obturator membrane. and inserts into the medial surface of the greater trochanter of femur. The obturator externus muscle covers the outer surface of the pelvis. The muscle is flat and fan-shaped. Its innervation comes from the obturator nerve, and the blood supply comes from the obturator artery and medial circumflex femoral artery. The obturator externus muscle helps to steady the head of the femur and the acetabulum of the pelvis, and also laterally rotates the thigh at the hip. The biceps femoris has two heads of origin, the long head and the short head. The long head of the biceps femoris arises from the upper and medial part on the back of the ischial tuberosity, while the short head arises from the lateral lip of the linea aspera on the posterior femur. Both heads of the biceps femoris are inserted into the head of the fibula. The long head is innervated by the tibial branch of the sciatic nerve, while the short head is innervated by the common peroneal branch of the sciatic nerve. The biceps femoris muscle's vascular supply is derived from the perforating branches of the inferior gluteal artery, the profunda femoris artery, and the popliteal artery. This muscle flexes and laterally rotates the leg at the knee joint. The long head also extends the thigh at the hip joint. The semitendinosus muscle is a cylindrical muscle. It arises from the upper medial part of the ischial tuberosity and is inserted into the upper part of the medial surface of the shaft of tibia. This area of insertion is called the pes anserine. The nerve supply comes from the tibial branch of the sciatic nerve, while the blood supply is from the branches of profunda femoris artery. The semitendinosus muscle flexes and medially rotates the leg at the knee joint and extends the thigh at the hip joint. The semimembranosus muscle is flat-shaped. Its origin is in the lateral impression of the ischial tuberosity as a flat tendon. This tendon, from which the muscle originates, descends deep to the biceps femoris and semitendinosus muscles and forms an aponeurosis. The fibers of the semimembranosus muscle form around the tendon around the level of the mid-thigh and go on to insert onto the posterior aspect of the medial tibial condyle. Like the semitendinosus, the semimembranosus is innervated by the tibial nerve, which is the tibial branch of the sciatic nerve. It gets its blood supply from the first perforating artery of the profunda femoris artery and the inferior gluteal artery. This muscle acts on both the hip and knee joint in the same way as the other two muscles of the posterior compartment of the thigh. It is also an antagonist of the quadriceps femoris. At the hip joint, the contraction of the muscle acts to extend the thigh in synergy with the other two posterior thigh muscles. At the knee joint, As the muscle contracts, it causes flexion of the leg at the knee.
The femoral triangle. The femoral triangle is a triangular depressed area situated in the upper part of the medial aspect of the thigh, just below the inguinal ligament. Its boundaries are as follows. Superiorly, the inguinal ligament. Laterally, the sartorius muscle. And medially, the adductor longus muscle. Its floor is gutter-shaped and formed from lateral to medial by the iliacus muscle, the psoas muscle, the pectineus muscle, and the adductor longus muscle. Its floor is formed by the skin and fascia of the thigh. The femoral triangle contains the terminal part of the femoral nerve and its branches. The femoral sheath, the femoral artery, and its branches, the femoral veins, and its tributaries, and the deep inguinal lymph nodes.
Tayo.